prostate cancer is uncommon in men under 40. The risk rises significantly after age 50, and most cases are in men over 65. The biggest prevalence for men having prostate cancer is 70 to 74, although this number is sliding down with better screening and better detection. Now, that's a small set of the population. But if we look at cancer deaths from prostate cancer, it's estimated in 2024, 35,250 deaths will occur from prostate cancer in the United States. And I know it's easy to look at this number and we can compare to other types of cancers and other ways people die, like heart disease, which is still massive. However, it's still heart-wrenching. It's not a number. It's not a statistic. This is an uncle, this is a parent, this is a husband, this is a dad. So I want to have this conversation. And really, before we go any further, I want you to share this with a man in your life, because a lot of times the conversations around aesthetics and longevity and cancer, we don't overlap. And we're going to talk about best practices if you're going to be on a DHT blocker. Really short, really sweet, really actionable. Number one, we are going to establish a PSA baseline. We want to get tested before we start an over-the-counter or a prescription DHT blocker. We want to ensure that we have a baseline comparison so we can identify any changes. That's all. So that's number one, PSA baseline. Number two, we also want to look at testosterone levels and we want to look at DHT levels. That's going to give us a more comprehensive picture. So we, again, have something to compare to over time as we move into a different age bracket, right? Here's the thing about the DHT blockers. The minute you stop them, you're probably going to lose and accelerate all the gains you had in taking that medication. So it's a forever thing. Lots of times, as it being a new medication within the last 10, 20 years, that we're going to move into a different age group. So there's an unknowns happening as the first wave of human beings using this. So I think it's better to be informed. Number three, and this was the one that kind of set off the red light in the room for me, or whatever the big flashing red light that's indicating we should do something right now and deepen our level of awareness, is you want to inform your healthcare provider about DHT blockers. You want to have a conversation. Most of these things we can just get online now, or you can get them at the grocery store, or you can get an over-the-counter. But if you're on a DHT blocker, we are going to be adjusting your PSA level. For example, a PSA reading on finasteride, or minoxidil, or Hims. These are just different types of this DHT blocker medication, branded and marketed as such. Are the PSA readings, we're going to double them if you're on one of those medications, right? So we need to understand that the levels could be suppressed by 50% while taking a DHT blocker. This has been from my research that I've seen online. And the reason why it's concerning is because the adjustment it's not really established across all practices in medicine. And we can have different responses within the train to all these things. Let me be more clear. So what I really want to be aware of is, like, we want ongoing monitoring of the PSA, right? Every 3 to 6 months after starting a DHT blocker. And we really want to listen to the body, because everybody's body is going to respond to this differently. We want to report signs of urinary difficulty, pelvic floor discomfort, sexual dysfunction. You go right to your doctor with that. And then we want to monitor our general health and look for unusual symptoms like fatigue, malaise, bone pain. These can indicate an underlying issue. And obviously, if you're a high-risk candidate, if you've got a history of prostate cancer or cancers in your family, you definitely want to do an annual check. And that, friends, it's really that simple. That's it.